Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, Engaging Stakeholders in Undergraduate Curriculum Development. We are pleased to be able to feature today's presentations, which were originally scheduled for the 2017 Undergraduate Public Health and Global Health Education Summit. Today's webinar will be 1 hour in length. We will begin with a short introduction of our presenters, followed by the two presentations, allowing time after each for questions. This webinar is part of the 2017 ASPPH Presents monthly series. The webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of each presentation. We are pleased to have with us today our speakers, Maggie Chorazy and Miranda Worthen. Dr. Maggie Chorazy is Director of Undergraduate Programs at the University of Iowa College of Public Health and a Clinical Assistant Professor in the Department of Epidemiology. The UI College of Public Health's undergraduate program admitted its first class of public health majors in fall 2016. Dr. Chorazy chaired the college's Curricular Innovation Task Force on undergraduate education in preparation for the new undergraduate program of study. Dr. Miranda Worthen is an assistant professor in the Department of Health Science and Recreation at San Jose State University in California, where she teaches undergraduate and graduate classes in epidemiology and global health and directs the undergraduate program in health science. Her research is multidisciplinary, focusing on social justice and public health. She has worked extensively in conflict or post-conflict settings in West Africa and with United States military service members and veterans. Thank you both for being here today, and I am going to turn the presentation over to our first presenter, Maggie Chorazy.
Okay, thank you for that introduction, Sarah. Can you hear me?
Loud and clear.
All right, let's get started then. So it's my hope that after participating in this webinar, you'll be able to identify at least one method for bringing together faculty, staff, and students to develop curricular goals, and to identify at least one benefit of an integrated curriculum as compared to a non-integrated curriculum. During today's talk, I'll provide a developmental history and timeline of the undergraduate program at the University of Iowa College of Public Health. I'll discuss the various strategies that we use to bring faculty, staff, and students together to develop curricular goals. I'll share with you an overview of our product, an integrated public health core curriculum that both values departmental contributions and simultaneously breaks down the traditional departmental 101 course model. I'll highlight what I perceive to be a few strengths of our approach and also some of the anticipated challenges. The College of Public Health at the University of Iowa has a long history of outstanding graduate education in public health, predating the founding of our college in 1999, when the Department of Community Behavioral Health and the Master of Public Health program were both created. Our recent experiences follow the observed national trend of increased interest in public health at the undergraduate level. We've seen increased enrollment in our undergraduate certificate in public health, rapidly increasing enrollment in our Introductory Fundamentals of Public Health course, and increasing interest and enrollment in our undergrad to grad combined degree option, which allows students to get both their master's degree in any major and their master's degree in 5 rather than 6 years. In 2014, the College of Public Health began work towards the creation of an undergraduate public health program. In April 2015, the Iowa Board of Regents, the governing body for Iowa's 5 public educational institutions, approved the undergraduate major in public health, clearing the way for us to move forward with curricular development. Our first cohort, as Sarah said, of undergraduates arrived just 16 months later in the fall of 2016. It may be important to note that admission to the public health major in fall 2016 was restricted to new first-year students admitted directly from high school. Admission to the major has since opened to current University of Iowa students, and course development is ongoing. Our undergraduate work group was brought together under a broader collegiate curricular innovation initiative, which sought to do the following things: to train highly qualified public health professionals in research and practice disciplines with the skills necessary to address current and future public health challenges across the globe, to establish an innovative and engaging curriculum that reflects workforce needs and student interests and uses the most current and effective methods and tools, and to provide an environment where all students have the opportunity to engage in interdisciplinary and interprofessional education, community engagement, and service learning. A 7-member undergraduate work group was formed to represent all departments and programs, including faculty, staff, and students. Since its inception, I've been the chair of that committee. Our initial charge was to develop competencies for the undergraduate major in public health and to define content areas which would differentiate the 2 degrees which we were offering, namely a Bachelor's of Arts in Public Health and a Bachelor of Science in Public Health. We reviewed existing undergraduate programs at CEEF-accredited schools of public health, as well as guiding frameworks and principles related to baccalaureate public health programs, such as the ASPPH Framing the Future report on recommended critical component elements of an undergraduate major in public health. We convened multiple college-wide meetings and gathered feedback from all collegiate stakeholders, including faculty, staff, students, as well as alumni from our graduate programs and practice partners. As I mentioned earlier, it was from this group that Undergraduate Competencies in Public Health were formed. We've since played an ongoing role in curriculum development and review, including solicitation and review of new course proposals and the creation of specific degree requirements for our programs represented in plans of study. The group also plays an important role in maintaining communication with partners in the college. So I'd like to take a moment to highlight some of the ways in which our faculty and our students specifically were involved and continue to be involved in the ongoing development of our program. Faculty were involved through regular communication at both departmental and college-wide faculty meetings, collegiate open forums, which occur regularly throughout the semester, and special meetings to facilitate faculty input in competency development for the undergraduate program and faculty collaboration in course development specifically. We solicited course proposals from our faculty for new courses in the undergraduate program. Faculty whose proposals were selected for development were generally eligible for compensation upon completion of developing course materials. And this was sort of an added incentive for our faculty to get involved in the undergraduate program. To encourage interdisciplinary course development and team teaching, we allow that the first 2 times a faculty member team teaches an undergraduate course, they would receive a full 1 course credit from an effort allocation standpoint. Undergraduate courses could be taught either as part of their regular teaching load or as teaching overload according to the needs of the department. It's important to say that we worked really closely with departmental chairs and the dean's office here in the college to ensure that both needs of both the undergraduate program as well as our graduate programs were being met. And then in partnership with the University of Iowa Center for Teaching, we hosted professional development opportunities 1 to 2 times per month during the academic year, which provided opportunities for our faculty members to brush up on innovative and effective teaching methods. These seminars also oftentimes provided an opportunity for faculty to express concerns about teaching undergraduates and for us to try to help alleviate some of those concerns. In general, the seminars were well attended, and faculty who only had plans to teach in our graduate programs often attended as well and found the content to be helpful. As the undergraduate program director, I meet regularly with faculty members who are developing our courses. As part of ongoing program evaluation, faculty teaching in the undergraduate program meet annually at a summer teaching retreat to review the past academic year and to make plans for the upcoming year. As we did with the faculty, graduate students were also involved in the developmental process through regular communication with graduate student leaders of college and departmental student organizations, collegiate open forums, and special meetings to facilitate input in competency development. Now that we have our own undergraduate students on campus, which is really exciting, we're also involving our majors in this process. During the past academic year, the Undergraduate Program Office conducted both formal focus group meetings as a part of our first year student seminar in the fall, as well as informal small group meetings throughout the spring semester to obtain program level feedback from students. We also regularly evaluate our undergraduate courses, both mid-course and end of term. So, what did we come up with? As I mentioned previously, the College of Public Health at the University of Iowa offers 2 degree options for undergraduate majors in public health, the BA and the BS. Our students don't have the option to specialize any further, for example, in epidemiology. And this is really a conscious decision. The expectation is that our public health core curriculum will lay a foundation for all disciplinary areas within public health, and that any further specialization would require additional education at the master's level. Our curriculum is largely brand new, aside from 3 courses that have previously been taught to undergraduates. Both the BA and the BS share a 30-semester-hour public health core curriculum, which is largely interdisciplinary and team taught. Each degree then has approximately 20 to 25 semester hours of coursework specific to that program. The BA students have a curriculum that's intended to provide an overview of the intersection between public health and the social sciences, policy, economics, behavior, etc. Whereas the Bachelor's of Science curriculum is intended to provide an overview of the intersection between public health and the biomedical sciences. And their curriculum includes additional coursework in biology, chemistry, calculus, and computer science. Both degree programs have substantial room for electives, require 3-semester sequence of professional development seminars, an experiential learning requirement, as well as a public health capstone course. So the courses listed here on this slide form our public health core curriculum. And I'd like to highlight just one course, CPH 1600, Public Health Science, Inquiry and Investigation in Public Health, as an example of how this core curriculum is largely integrated, interdisciplinary, and team taught. So this course specifically is designed to introduce evidence-based public health through the various sciences that support public health research and practice, public policy, and population-based interventions, with particular emphasis on biostatistics and epidemiology. I am one of 2 course instructors, and I share day-to-day teaching responsibilities with an instructor, Dr. Newt Carter from the Department of Biostatistics. And this might be the point in time to remind you, as Sarah said, that my home department in the College of Public Health is epidemiology. Through this manner of team teaching across departments, so in this case epidemiology and biostatistics, we're able to break out of sort of the epidemiology 101 and biostats 101 mold for introductory courses and provide this introductory content across multiple courses and time points across our undergraduate curriculum. So what's worked particularly well for us? The development of our undergraduate curriculum, I have to knock on wood, has been to date a very smooth process. This would not have been possible without visible and vocal commitment by collegiate leadership, including our dean, the associate deans, departmental chairs, and program directors, including the MPH program. This support was absolutely essential. Our process allowed for and encouraged collaborative engagement of faculty, staff, and students. As a result, departmental silos were broken down and people started to think outside of their disciplinary boxes, so to speak. It's interesting to note that we've seen continued collaboration across departments and other areas of focus for curricular innovation related to our college's graduate programs. So that's been sort of a really nice side effect, so to speak. Through this process, we were able to develop a brand new curriculum that ensures the academic integrity of our graduate programs as well. Specifically, our integrated undergraduate core curriculum operates very differently from our current MPH core and is leveled appropriately for undergraduates who aren't expected to specialize in any one public health discipline. We did face some challenges along the way. There were certainly many opportunities for miscommunication. In our case, particularly as a result of the length of time over which our curriculum was and continues to be developed and rolled out. So since we started with first-year students directly admitted from high school last year, we're rolling out our curriculum on a year-by-year basis. Our 2,000 level courses, for example, will be rolled out during the next academic year. But regular and frequent communication, we found, has been essential to preventing misunderstandings from those potential opportunities for miscommunication. So we try to regularly maintain communication with all of our stakeholders here in the college and outside of the college to minimize those challenges. In an environment of limited resources, especially in our case faculty time, certain groups may want to circle the wagons and maintain departmental silos. We were fortunate in that we really didn't run into this, but I think that we were able to head this off by involving departments early on in our process and really getting buy-in from the departmental chairs early on as well. And I think it's important to realize that if any program with an existing graduate degree program were to develop a brand new undergraduate major, I think that it's sort of natural and appropriate to ask how the undergraduate program could impact the existing graduate program. Perceived threats to existing graduate programs can be minimized or mitigated through that sort of maintaining the regular communication channels. So as we found with all of our challenges, communication has really been the key to overcoming them or to preventing them from being a problem in the first place. So let's see, as I come to a close here, I hope that you now have some further examples of strategies to bring partners together. Again, I'll reiterate that the support of institutional leadership is critical to the development process, and the results of the effort may have long-standing effects, positive or negative, on the culture of an institution. So in addition to thanking all of our collegiate partners, faculty, staff, and students, and our other on and off-campus partners here at the University of Iowa, I'd like to specifically acknowledge the work of past and current members of the Undergraduate Work Group, the College of Public Health Executive Committee, and the University of Iowa Center for Teaching for their support throughout this process. And with that, Sarah, I think we have some time for questions.
Wonderful. Thank you so much, Maggie, for sharing with us the entire process. Very quick process, it seems like, looking back at it. I would like to remind all of our attendees to please submit their questions via the question box, and we will address them now. The first question asked is, the first attendee is wondering how many faculty you have at your College of Public Health and the percentage of those faculty that also teach undergraduate courses.
Okay, so yeah, I would say, and I should have had this number at the top of my head, we probably have approximately 60 full-time faculty, primary faculty in the College of Public Health. And I would say that about, if I had to hazard a guess, let's say 15 to 20 of those faculty are involved in the development of the curriculum in a more substantial way. So either they are teaching courses or developing courses or otherwise involved in committee work related to the undergraduate curriculum.
Great, thank you. Do the faculty have suggestions for improving the development seminars that they've had thus far after starting to teach the undergraduate students?
I'm sorry, can you repeat that question? I'm not sure that I quite understood.
Sure. So you had mentioned that you had development seminars for faculty development seminars for teaching undergraduate courses specifically. And did they have any recommendations or suggestions for improving them after they started teaching the undergraduate students?
You know, we haven't gotten any specific feedback from our faculty now that we've had the undergraduates on campus. I guess what I'm finding from both our faculty who are teaching undergraduates as well as our graduate students is now that we've had these professional development seminars for a year, they're looking for more specific topics or skills to develop. So we've had sort of general seminars on how to develop or redesign a new course. And those are sort of broad, 10,000-foot level types of seminars. And now our faculty are really interested in getting into like the weeds, the nitty-gritty details. So they have suggestions for us to follow up with additional specific topics within those broader topics. More of those seminars seem to be universal across teaching in higher education, not just to the undergraduates. And so we haven't really had any very specific feedback now that the undergraduates are here on campus.
Great. You covered everything. The next question asks, can you explain what you mean by not compromising graduate education?
Sure. So I think here when we were starting up the undergraduate major in public health, there were some concerns that there would be duplication or overlap or inappropriate leveling of the undergraduate program such that it would sort of not minimize the effectiveness or the importance of our graduate programs, but just sort of invade their space. So let me put it that way. So there was some concern, for example, that if we had developed an Epidemiology 101 course for undergraduates, how different would that be in practice from the Epidemiology 1 course, Introduction to Epidemiology, that we offer to first-year master students. I think that some programs nationally might use the same course to teach both groups. And here at the University of Iowa, we wanted to be very conscious and deliberate and mindful of separating the audiences and making sure that the introductory epidemiology content, for example, was then taught differently for the undergraduates at an appropriate pace and level. And by encouraging team teaching between biostatistics and epidemiology, for example, we were able to sort of break out of our usual introductory course molds and think through this more clearly. So when I say the academic integrity, it's sort of that perception that the undergraduate courses, if we're using our graduate courses, which we're not, or if we're developing them in such a way to invade the space currently occupied by our MPH program, for example.
Thank you for that explanation. I think certainly a lot of people are coming face-to-face with that issue as well. The next question asks, can you share current and projected enrollment for the BA and BS programs and plans for enrollment management?
Yeah, so our target for this first class, the cohort that we brought on in fall 2016, was 25 students directly admitted from high school. We ended up with 32. And of those 32, 22 are continuing on as returning students in the second year. We've also since opened a standard admission process by which University of Iowa students can add the major or change to the public major once they're here on campus. And we have doubled our graduating class of 2020 with the addition of those standard admits. So we're anticipating approximately 45 students in the class of 2020. Our direct admission numbers, those students straight out from high school for fall 2017, has been fairly stable with some increased growth. So we're expecting about 35 students this year from that direct admission class. We think that our growth will largely come from that standard admission route once students are here at the University of Iowa. They'll take our Fundamentals of Public Health course, which counts towards the social science gen ed here at the University of Iowa. They'll find our certificate and maybe want to convert to be a major or through sort of other advising routes, start out as pre-med and then want to change to public health. They'll find their way to us. So we think most of our growth will come from those standard admission students. Our goal eventually is 125 students per graduating class. So in any given year period, once we're up to that level, there might be approximately 500 undergraduate students on campus with us between 4 cohorts cycling through. Admissions and or enrollment management here at the University of Iowa is largely data-driven. And we have wonderful partnership with the University of Iowa admissions office in helping us to see where our current standings are and what our predicted future enrollment is and needs for classroom space, for example. The college itself is a partner in that, in supplying data and target enrollments. And so we work very closely with them to manage that. But it's data-driven.
Wonderful, thanks. And I think we have time for one more question before we move on to the next presentation. You had mentioned that you reviewed existing undergraduate programs in order to create yours. Can you share kind of your process for that? Were you examining websites, or did you have contacts at each of the undergraduate programs?
Yeah, it was largely website driven. Going through sort of either ASPPH or CEF portals to identify CEF accredited programs that had undergraduate majors in public health. We focused very specifically on programs that didn't differentiate further than that sort of general public health level. Most of our data we gathered through the web. Looking at, for example, learning outcomes or objectives or competencies for those programs, looking at how the bachelor's degree was structured in terms of content within the college or outside of the college. Occasionally we would reach out to colleagues at those colleges if we had some specific questions, but I would say about 85 to 90% of what we did was just through the web.
Thank you. All right, well, I want to encourage all the attendees to continue to submit their questions via the question box, and there will be additional time at the end for both Maggie and Miranda to address questions. Thank you so much, Maggie, and I'm going to turn it over for the next part to Miranda.
Hi, thanks. Well, I actually think that that last question is a great question to pivot on, because I'm going to talk about our process. And I think maybe as a way to frame the this whole session, I think what you're going to see are Maggie's example was within a context of a college of public health that already has a really strong graduate level program. And in our context, we are not part of a school or college of public health. We are a public health program, so we've had a continuously accredited master's program, but there's one track and it's a small program. And actually our undergraduate program has always been much larger than our graduate program. So those are, I think, some of the key differences between the context that Maggie was talking about in developing an undergraduate program in public health and the context at San Jose State. So this presentation is talking about developing an undergraduate public health degree really on a shoestring budget. And I just wanted to give thanks to my colleagues who have contributed a lot of work to this project. So to start with the context of San Jose State University, we have about 30,000 students at San Jose State. 83% are undergraduates. We are part of the California State University system, and as part of the master plan for higher education in California, we are the band that teaches four-year or bachelor's degrees and master's degrees. I paused at 4-year because hardly anyone gets through in 4 years. It's very ethnically and racially diverse campus. About 48% are from the local county around San Jose State. And I think importantly, as part of our context, the number of students at San Jose State from the lowest income quintile is more than all the Ivy Leagues combined. So we have a very diverse and also a very large proportion of non-traditional college students. Our department is the Department of Health, Science, and Recreation. We will be changing our name this coming year, most likely to Public Health and Recreation, but maybe to Recreation and Public Health, we'll see. And we have existing undergraduate programs in the stream of health science and in recreation. And this year we went through a process that was department, college, university, and then actually the Board of Regents of the Chancellor's Office for the Cal State University of switching our degree name from health science to public health. So starting in the fall, we will be offering, instead of a BS in health science, a BS in public health. Similarly, a BS in public health with a concentration in health services administration, and then minors in public health and health professions. And then we offer this one master's program, or MPH, with a specialization in community health education. So our master's program is there's one track, and it's with a community health education focus. I wanted to also just kind of show you that we have a recreation program as a part of our department. The recreation program had been separate, and they joined our department in 2013, recognizing a lot of complementarity between public health and recreation as this program conceives of it. In the health science undergraduate program, we have already about 585 majors. I think that's now more like 600. And we have over 50 minors in health science and health professions. We have a very, very small faculty with 2 assistant professors and 1 associate professor. That was actually our status in March. It's changed a little bit. Our associate professor left. I was then promoted to associate professor, so it's a little different. And we are largely driven by our adjunct lecture faculty. And so we have typically about 30 lectures each semester, many of whom teach multiple classes and have taught for many years. So we have lecturers who have taught for 30 years in our department. So while they don't have administrative responsibilities or sit on committees or things like that, they play a large role in the teaching of our program. So in the transition that we've been making, I'm going to kind of go through, whoops, that just advanced in a way that I wasn't planning. From 2013 to 2015, our faculty were really engaged in a conversation about whether to revise our undergraduate curriculum and whether to seek accreditation. This coincided with our regional accreditation WASC program plan cycle. And so we regularly discuss this at our monthly faculty meetings, but we never devoted an entire faculty meeting to it or even had a retreat or anything like that. It was just something that was on our agenda regularly to revisit and discuss. And we did some initial research on the requirements of becoming accredited. And then in spring 2015, we took a faculty vote to devote some resources to really investigating this more thoroughly. And so in the fall of 2015, the resources that we allocated was 1 faculty member, myself, and I had 1 course release, so a 0.2 assigned time. And my first step was really to review the SEAF criteria, and then similarly to what Maggie was saying, I analyzed the curricula from about 70 programs, and I used the SEAF website, and then from that search was able to then look on the actual program website for each of the programs that I thought were somewhat comparable to what we were interested in pursuing. And then I compared what I took from those programs to our current health science curricula and looked at what the gaps were where we had redundancy in our curriculum. And then I also did quite a bit of work. This was, I think, my second or third year at San Jose State, so I really also wanted to understand the context. And in California, we were dealing with a new law, came down from the legislature, SB 1440, which created a new pathway for students to transfer from community college to the Cal State University system with a guarantee that they could graduate in 2 years, 4 semesters. And so with that law, it kind of mandates what we can offer at the undergraduate level, lower division versus upper division, how many units we can specify, what kinds of prerequisites we would anticipate students would have been able to complete while in community college. And then also looking at the details around our budget and how resources are allocated within the college and within the departments to understand kind of that broader impact of changing an existing program. So this is when you're actually changing an existing program, of course, there are a lot of stakeholders and a system that works well. So you want to figure out how to do the right amount of tweaking and not tweak too much. I thought I'd share this spreadsheet, which is a little bit about my, I hope you can see my cursor. So this was the spreadsheet for the research for other universities. So these are the different other programs that I looked at. And as you can see, I was very much in the framework of what are the courses called. So, you know, what schools require human biology or physiology or statistics, what colleges or courses require anatomy. And so looking at these as the general preparation courses, and then this last row is where I plugged in what the courses are that we offer in our program. And then the second page of the spreadsheet was looking specifically at the core public health courses. And so what other schools were requiring in terms of global health or had an introduction to public health course, and really trying to map on what our existing curricula was to what I looked at in other schools as being, you know, standard. And so my findings from that research were really that our current program wasn't particularly coherent as a public health program, and it wasn't firmly situated in any particular expertise or emphasis, but we did have a slight emphasis on community health education. This makes sense because that's what our master's program is in, and that seems to have influenced our undergraduate program. But it wasn't really a community health education undergraduate program. Gaps existed. For the general public health degree, it also had gaps, but we did as a department offer courses that could have filled some of these gaps. For example, we offer an environmental health class that is a general education upper division class for the university. It's actually not required as part of our health science curriculum. Similarly, we offer a global health class that is not required as part of our core curriculum. And we have a concentration, this is Health Services Administration, and it looks pretty comparable to other Health Services Administration concentrations. And this made sense because it was only developed about 5 years ago, and so it was more coherent and consistent with the trends towards what that kind of degree would require. So the following semester, I again had one course release, and I moved ahead to develop some proposals and revisions to the degrees, and that included creating a community health education concentration. And this was really trying to capitalize on the strengths of our faculty, the interests of our students, and then also create a pipeline for our students to go into the master's program in community health education. And I think it's interesting that we did not experience much pushback from the faculty who teach primarily in the master's program. And I think this is largely because we have this existing undergraduate program. And so when we talked about developing a community health education concentration, there wasn't a sense of threat that would in some way teach the courses that are at the master's level. I think we all have experience teaching undergraduates and recognize that the level of an undergraduate course is different from the level that we expect of master's students. And we also have experience with master's students teaching our master's students who have graduated from undergraduate curriculum and then continue to learn quite a lot through our master's program. The following fall, I did a lot of stakeholder outreach, and we did the work to propose the degree name change. And I want to say a little bit about that because in some respects it seems easier to propose a whole new degree than to modify an existing degree, especially within a largely bureaucratic system like the California State University system. When I wanted to propose this degree name change, my associate dean gave me a 40-page document with lists of all of the possible names that you could change your degree to. And you're not allowed to veer from this list of approved degree names. And so it was very much kind of looking through, and fortunately other Cal State University campuses already have public health, so we were able to do that. But there's no place for, say, health policy as a degree name. So there's a lot of restraints. With the stakeholder outreach, I did focus groups with both lecturers who would be teaching in our program and who have taught and have a lot of observations about our program, and with tenured and tenure-track faculty. I also did one-on-one and small group conversations with lecturers. And I think this is important. Our department, we've had a lot of turnover in higher level faculty. Our deans, we've had 3 deans in the last 4 years. We've had 3 department chairs. And so lecturers have been, I think, feeling quite burned and are hesitant to give up their time without compensation. And so without money to devote to incentivizing them to attend meetings, I did have to do a lot of going to them when they were available. So I did a lot of meetings where I would attend their office hours, and if there wasn't a student, I would get an opportunity to talk with them, but otherwise, I'd wait and we'd make another time that was convenient. I also did one-on-one conversations with internship preceptors and employers of our students and our graduates to hear what they thought were the gaps in the skills that our students graduated with, and also what they thought we were doing well, so that as we're modifying our curriculum, we could ensure that we maintain the strengths and the depth while also adding additional training. And I did focus groups with recent alumni, which were fascinating, really, really interesting. And then we had a follow-up meeting that combined both alumni and current students to talk about the curriculum. And we did an alumni survey. We had 108 survey responses. And I met with also community college advisors to understand that pipeline, so what the students are getting at the community college level before they transfer to San Jose State. I also visited classrooms. So I attended, I visited 2 different classes that had over 100 students enrolled. In order to talk about this process, there was a lot of fear and trepidation, and I wanted to gauge our students' interest in changing over to a public health degree. And there was overwhelming support from students and from our alumni, actually, in changing our degree name to public health. The most common question that I got from students was from students who would be graduating before the new degree name and new curriculum came out, asking whether there was any way they could still get the degree title called public health. I also visited with 2 of our student groups, and then I collaborated with one of the student groups, the health science peer advisors, to develop multiple opportunities for students to provide anonymous feedback. This is, a list kind of down below. I won't go through each of these things. But there were many, many ways that both students, lecturers, and tenure track faculty could contribute, and as well as alumni. For the degree name change, we had to create quite a lot of paperwork, provide supporting documentation, and then to meet with levels of committees at the college level. We had an undergraduate studies committee, curriculum and research committee, and as Maggie was saying, definitely getting the support of our dean and our provost was essential to this process. So I met multiple times with our dean and the provost to make sure that they were aware of this process and supportive of the process. So this past semester, I continued doing this work, and at that point I felt like it was really essential that we bring on additional faculty to work on it. So we had 2 lecturers who received assigned time, and one other tenure track faculty member who received some assigned time. And the scope of our work was basically to decide everything and write everything and plan everything. And that is a lot of work, and we didn't quite get through it. So when I initially did this presentation in March, I thought we were going to be further along than we got. So our tasks were to create program learning outcomes for the new BS in Public Health degree and program learning outcomes for each concentration, and then to finalize the degree requirements for each degree, which includes some existing courses as is, some existing courses modified, and some creating new courses. And then to solicit faculty input regarding modification of those courses, so modifying our course learning outcomes to map on better to the new program learning outcomes. And then as part of that, because we have so many adjunct faculty, we thought it was important that faculty have an opportunity to really design the course that they're comfortable teaching. And so while we wanted to have course learning outcomes that are consistent across multiple sections, and also to have essential assignments that are consistent across multiple sections, then to also have opportunity for flexibility for faculty to develop and modify courses as they see fit. We also were preparing for pursuing accreditation, so we are not going for accreditation quite yet, but as a part of that, we are doing all the work to map our course learning objectives to our program learning objectives to the SEEP criteria. We are creating new electives, and so we wanted to phase those in, and then to, as I said, to make those course modifications, propose some new courses, and to prepare all the necessary documentation. So there's a lot of paperwork that goes along with both modifying courses and proposing new courses that gets approved through the different levels of the university. And then from the programmatic perspective, so I direct our current undergraduate program, and we teach about 90 sections of classes each semester, which is a huge number of classes to schedule and faculty to hire to teach those classes. And so one of the things in creating these modifications that we wanted to do was to create some predictability for both our tenure track and especially for our adjunct faculty. And so to develop a schedule for fall and spring classes that allows students to go through the major without having course conflicts, and with having some flexibility for students who pursue their bachelor's 2 classes a semester or 4 classes, or pilot in and try to take 5 or 6 classes all each semester. So our plan is really to develop these schedules so that they are consistent, and we can expand slightly as we admit more students, but also contract if for some reason the resources from the university are decline and we have to teach fewer classes. As part of this, it's actually projecting what the cost is for teaching each course based on average faculty salary. So I created a financial spreadsheet basically with all of these numbers about if we have a course that we reduce its size to 25, say, because we're making it writing intensive, or we expand a class and offer it once a year at 250 students instead of twice a year at 110 students. Because resources in our department flow, or in our university flow with, we call it butts and seats, right? So each time you teach a student, you get a certain resource to the department. So actually making sure that the program that we're proposing is financially viable. And then we need to revise the number of students to admit based on actually how many students our program can teach. We are going to be requiring more classes, more credits than our current degree, which means that we actually are in negotiations with our dean about getting the allocation to teach an additional number of students, which is a bit of a zero-sum game, so that has to come from other majors, so it is a negotiation. And then to create a clear pathway for program growth, which is the desire of our administration. And then for our students, what we need to do, because we're transitioning from an existing program, is to create advising roadmaps for students who are currently at different phases of our curriculum. And one of the things that's complicated here is that students have a legal right to the curriculum that was on paper when they were first admitted to either the Cal State University or to a California community college. So that means that we have students who are not even at San Jose State yet who have rights to the current curriculum. So we will need to be able to teach out that curriculum while at the same time phasing in the courses that are required for the new curriculum, which then means that students can get quite confused because they'll be sitting in a class with someone whose requirements are different from them. So they might be in the same first-year class, but actually each have an entitlement to a different set of required courses. So these advising roadmaps are quite complicated, but the plan is basically to provide transparent substitutions for students opting to exercise their rights to this earlier catalog. So just in conclusion, there are clear advantages and disadvantages to starting with an existing degree versus starting from scratch. It's important when you are operating on a shoestring budget to actually go to the stakeholders, to not anticipate that they will come if you hold a retreat or if you hold a working group, but rather that it's incumbent to solicit all the feedback. And then I think it's worth budgeting for additional faculty designers to come in at critical junctures in order to maintain buy-in from everybody and ensure that you're getting the very best product. And then I think knowing your bureaucracy is important, so anticipating whatever the hurdles will be and smoothing them out in advance. And that's it, so I'd be happy at this point to take questions.
Wonderful. Thank you so much, Miranda, for sharing all that you've done. It is an impressive amount of work that you have accomplished. And I'll just remind everyone that they can ask questions by submitting their questions to the question box. So the first question actually is just has to do with that amount of work. How many interviews did you complete with lecturers, preceptors, and employers, and over what amount of time?
I think I mentioned we have about 30 lectures each semester. Some of them only teach in our master's program, so there's probably about 25 lectures. And I think I spoke with probably 18 or 20 of them. Some of them I spoke with multiple times, especially those who might teach 4 courses a semester who have great experience, many years teaching in our curriculum. Preceptors, I spoke with 5 or 6 preceptors. Again, there's some overlap there, so some of our internship preceptors also teach. We have people who work in our Department of Public Health, for example, who teach 1 course in the evening in a semester. And so during their day job, they might be precepting some of our interns, and then in the evening, they also get the opportunity to interact in the classroom as they teach something related to their expertise. I spoke with, in the focus group discussions, I spoke with probably 15 alumni, and then I don't think I could even begin to count the number of current students I spoke with, but it's dozens of current students that I had conversations with about the curriculum.
Wonderful, thank you. And then could you say the percentage of students that you have that come from a direct admit versus a community college transfer in and versus a change of major student?
Yeah, I have these numbers. So, and that's important because the requirements are different and how they get some of their courses met are different depending on these different pathways. So when I was creating the financial model, that all got factored in. About half of our students are transfer students directly from community college who are admitted to the public health major. A quarter of our students are admitted as freshmen as public health majors. And another quarter of our students are admitted as change of major students. So they are admitted to San Jose State in another major or admitted as undeclared. And at some point during their time, they apply to change their major to public health. That's been an important way that we've maintained our numbers at different time periods where we've had contraction through other processes. But we are getting more and more transfer students applying to public health directly, and so we're actually having to reduce the number of change of major students, as we call them.
Wow, that's exciting. You're planning to launch this newly revised curriculum this fall, is that correct, or has it already been launched?
So it's a year-long process to get the degree template for the new requirements approved. So what we are doing right now is we have courses that we are already starting to substitute for other courses, but we haven't submitted the degree template modification yet because our advising system isn't quite worked out. And as I said, the place that we're actually most stuck right now is around having clear guidance from our dean that we will get the kind of allocation of space to teach students that our new curriculum would require. So we have to balance, if we institute the new degree requirements while we have 600 majors, we'll be increasing the number of courses that we need to teach. And so we will either need to decrease our number of students to maintain the same number of courses or get additional allocation so that we can teach that higher number of courses. And until we have that worked out with the dean and with the provost, I don't want to actually submit our curricular modification because we just may not be able to actually teach all those courses yet. So we're in a bit of a holding pattern. We are starting to actually offer components of the new curriculum, but it's not yet fully up and running.
Certainly makes sense. I, in the interest and to be respectful of your time and also the participants' time, I'm going to let everyone know that if they have additional questions, please email me. It's at asppph.org, Swiner, SWEINER, at asppph.org with any questions, and I'm happy to pass them along to our presenters today. And you will be receiving a follow-up email from me when this the recording of this presentation has posted. I do want to say thank you to Maggie and Miranda for presenting today and sharing with us all the work that they've done. I want to remind everyone this is where the presentation will be archived and within the next 48 hours or so. And to let you know of some upcoming presentations, webinars that are in the next few weeks are listed on your screen, and also to let everyone know that pending another snowstorm, we should have the 2018 Undergraduate Summit on March 7th in Arlington, Virginia. Thank you all so much for spending some of your afternoon with us, and have a great rest of your day. Thank you.